We love dogs. We tolerate their breath. But we know bad breath isn't just a nuisance. It can be a sign of canine dental disease. Sure, daily brushing to keep teeth clean is ideal, but getting a dog to cooperate can be a real challenge for many pet owners. Greenies dental treats are vet recommended and clinically proven to promote oral care when used daily between professional cleanings. Plus, they're irresistibly tasty and VOHC accepted for plaque and tartar control, with a texture designed to clean teeth effectively with every chew. So if you're looking for a routine they'll actually stick with, Greenies dental treats are the perfect place to start.
Welcome to Veterinary Vertex, the AVMA Journal's podcast where we delve into behind-the-scene looks with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. Today, we're discussing how barriers to care might impact animal and human welfare and the professional experiences of veterinarians with repeat guest Simon Haeder. Simon, thanks so much for joining us here again today.
Yeah, thanks for joining us, Simon.
Thanks for having me.
So, Simon, can you start by summarizing the purpose of the study for our listeners?
Yeah, so as we know from my last conversation with you guys, not a veterinarian and not even close, but I'm a health and healthcare services researcher, and so I know a lot about the human side of healthcare. And pet owner, love our dog, who recently unfortunately passed away, but very interested in veterinary care and animals, especially dogs. And so I dabble in the literature and I learn a lot, and I notice a lot of gaps, that we've kind of started to close on the human side that we haven't really addressed in the veterinary side. And so one of the things that I thought hadn't been really addressed well was, when people need care for their pets, can they get it? And so that's kind of where we ended up with this study.
Simon, for those unfamiliar with what a secret shopper survey is, why use this and what is the approach useful in veterinary medicine?
Yeah, I'm obviously biased because I've done these a lot on the human side, but I think they're really, really helpful. We try to learn about people's experiences, and there's many ways to do this. One is just use a standard survey, but then people have to recall things and they might forget things and all those kind of things. And so, a secret shopper survey is basically trying to get more reliable data. So you kind of mimic the experience of real patients or consumers or all kinds of things been used in many different fields. But basically, you try to, in our case, mimic what a veterinary patient would experience trying to get care and collect data, and then learn something about the general situation of how people access care.
Yeah, super interesting. In what scenario did the callers use when requesting an appointment?
Yeah, so we mimic kind of the approach that we've used extensively on the human side. We looked at 6 states, that we've done on the human side before: California, Washington, Pennsylvania, Ohio, Texas, Minnesota. We generated basically a profile for a patient. We had like a slack of real but realistic home addresses. We had names, dog names, gender, and all those kind of things. Randomly assigned them to our callers. Our callers then, put in the home address into Google search, looked for the closest veterinarian to their home address, put all that information into into our data system, then called the veterinarian and tried to get an appointment. We had a kind of common script. I think that made a lot of sense. You got a new puppy. Your new puppy needs to establish care somewhere. You need to get the first set of shots. And so that's, we had that script. And then we collected all the data and we did this, for more than 5,000 patients.
Simon, why were those 6 states chosen on the human and then also on the veterinary side?
Yeah, that's a good question. So, and in the most perfect world, we do every state and we collect enough data in every state, and then we get a truly representative picture of the country. It's often not possible, right? This is very expensive. You have to hire people, you have to train people. This is like costs a lot of money. And so what we did is we kind of looked at states that are diverse in many different ways, diverse geographically. You can think of California as the big cities, the rural areas, the mountains. We have different states that are very different politically, because that might matter too in many ways today when we think about healthcare: Texas, California, those kind of things, different ruralities, different regulatory environments. And so we picked something that's kind of really, really diverse across those dimensions. And we think that gives us a relative appropriate look at what the situation looks like across the country. Of course, we can't know quite for sure, but we had a lot of calls, we had a lot of different states across the entirety of the states, and so we're pretty confident in the findings that came out of this.
And in this specific study, what outcomes were you primarily interested in?
Yeah, again, we kind of look to the human side. The most important one when you look for care is always, can you get an appointment? That's a starting point, and then if you can't get an appointment, why can't you get an appointment? So we looked at the reasons for failures. On the human side, issues with provider directories play pretty prominent roles. So like people are listed incorrectly, the phone number it's wrong, it's the wrong specialty, all those it's not in your network, those kind of things. So we looked at those, and then we looked at when you get an appointment, how long do you have to wait for an appointment? That's a really meaningful measure for a lot of people. Like, is it a week, 2 weeks, those kind of things. And then lastly, we looked at how long do you have to drive? As you may remember from just a second ago, we have real home addresses and we have the addresses of the veterinary practices. So we can add an important dimension because you might be able to get care with someone in 2 days, but he's 50 miles away. And so that might be a big barrier for people as well.
And what did you find about overall appointment availability?
As I said, I come from the human side of medical care. Shockingly good, I think, is the answer. And I think that's something that maybe surprised me a little bit because a lot of talk about, undersupply of veterinarians and access challenges. And I think this is where the study comes in. But, 2 out of 3 calls actually got to an appointment. I think that's like unheard of on the human side, like unbelievably good. Like I'm still marveling I do a lot of human studies at the same time right now. And I go back to the veterinary side and it's like unbelievably good. Very few inaccuracies listed, so the phone numbers are generally correct. Just single digit errors there. A little bit of issues with capacity, but even in the single digits here as well. So that's something that's really really good. I think the thing that raised a little bit of concern, but again, it's still better than the human side is you. We had 15% of callers who couldn't connect to anyone, so they either ended up with an answering machine or some computerized system or busy line, and those kind of things. Or for another 8%, they were just put on hold for too long. You know, uh, we kind of use the standard measure. If you're on hold for 5 minutes, kind of move on. Like we mark this as a inability to access, which is pretty standard, and I think what most people would do too. And so I think overall, pretty great data on the accessibility. Wait times are really good too. On the human side, we are seeing wait times that are in the 50 to 100-day range for dermatology, for example. And our end, you could get an appointment within 6 days. In states like Texas, was even 3 days or 2 days. So quite amazing. Travel time was pretty good too. 13 minutes, I think, was about the average. And again, across these numbers, we get some differences across the states. That's quite obvious, but also across rurality. And I think that's one of the big drivers where the differences come in.
If we're doing so well, what were the most common barriers encountered for that other 1 out of 3 that couldn't get an appointment?
Yeah, it's kind of the things that I just talked about. I think just not getting an answer from the veterinary office. I think that's where some of the hooks are for potential solutions to this. Like, how can we make sure that if I call a veterinary office, I actually reach someone and I can get an answer whether I can get in or not. I think that's really important for patients. They might be really concerned about that dog, or that dog ate something they shouldn't have, and you're like nervous already, and then you're on hold for 5 minutes. That puts people through the roof and makes them really anxious, or you can't get anyone, and then you call the next one and potentially can't get anyone there, and so you get really really anxious, those kind of things. But again, much better than human side. A couple of capacity issues. I'm looking at the numbers now. Only 4% didn't have new appointments or weren't taking new patients. That's a really really good number, again, compared to human side. 2% inaccuracies. That's like, on the human side sometimes we have like 40-50% inaccuracy, so it's quite amazing.
Sounds pretty solvable, right? Answer the phone or get back to the messages.
Yeah, I agree. No, if we want to talk policy solutions, like, A, make it easier for people to schedule by offering like an online option. I think people really like this because then pick what's on their calendar. They don't have to wait. It takes barriers off for your practice as well. Use an answering service, or make sure that you have a front desk, which might be a challenge for a lot of practices that are particularly rural, I'm guessing, and you're like maybe don't have a staffer there full time, and so you rely on the answering machine. So finding those are like solvable problems, though, I think, and that reduces a lot of the limited barriers.
Yeah, it's a different population now, right? With the immediate gratification, people don't want to leave a message and trust that somebody's going to get back to them. So we're so used to online booking and QR codes and all those things. So we need to meet the clients where they are.
I think that's exactly true. It's like the same with our kids. Like if they have to watch a commercial or something, on TV, they just get totally frustrated. And I think it's something we create. Um, just a general expectation that I want something and I want it now, and so the barriers. But again, if you're very worried about your dog and you might be sick or hurt and you're trying to get in, that's a separate situation. But in most cases, I think that's probably a minority of cases.
Were there any notable differences between rural and non rural areas?
Yeah, I think that's kind of what stood out, and it's kind of, coming in from the human side, not unexpected. The rural patients just do a little bit worse in any regard. So they have a little bit harder time getting an appointment. They have to wait a little bit longer. Where the really comes in then is the driving time. It's about, additional 15, 16, 17 minutes of driving on average. What that, these are average numbers. What that doesn't speak to obviously is many of the outliers on the data set, the above the 90th percentile, those are probably people that live in rural areas. And so that might be, while the average is pretty good, I think this is a general takeaway from the study. The average is pretty good. We have outliers as like 10%, the 5%, where the travel time might be 50 minutes or 100 minutes or more, or it might be the wait times is 40 or 50 or 60 days. Those are the outliers. Those are hard problems to solve. And so, well, the overall numbers, I guess, is the general takeaway, kind of speaking ahead of where we want to go. It's the general access is good, but we have some outliers and it's hard to address those outliers, but we should obviously try to find some solutions for those.
Yeah, I grew up in rural North Dakota, and you think nothing of getting in the car and driving 45 minutes just to get a vaccine for your horse or some medication. Like, that's just what you get for growing up in a rural area. It's an expectation.
Yeah, I know what you're talking about. My wife's from the mountains, high mountains of California, so like everything is 2 or 3 hour drive. You get used to it. It gets problematic, obviously, when you have an emergency with your dog or you don't have the resources to necessarily travel, and those are the kind of things we need to start thinking about.
What were some of the other findings that surprised you, especially sort of relative to human healthcare?
Yeah, as I said, like I've run, I don't know, 300, 400,000 calls on the human side as a comparator. The numbers are really bad on the human side. The inaccuracies are really bad. The wait times are really bad. The travel times tend to be really bad. The frustrations are just so much greater on the human side. And that obviously has something to do with, on the human side, we have managed care arrangements. You have to go through your provider network. The provider network is presented to you by your carrier. There's lots of issues with this. You don't really have that on the pet side yet, although we have more and more insurance companies coming in, although it's more of the indemnity type insurance where you pick and then get reimbursed. But it wouldn't be surprising to me, with what we see on that side with the growing costs, insurance companies getting out of market because the costs are too high. If we start seeing managed care arrangements on the veterinary side as well, where you have to go to a subset of providers, and that subset has to be presented to you by the carrier, and then you have to like make sure that they update it and the numbers are correct, and then we will have to kind of see whether the frustrations creep in. But I think again, compared to the human side, so much better, and it's delightful in many ways.
So, Simon, how can veterinary practices use this information to improve client access and communication?
Yeah, we alluded to it a little bit. I think just making sure that if someone wants to contact you, they can. And I think, there's a lot of financial pressures on all kinds of veterinary practices. I think that's pretty well established. If you can automate some of these things, and I think we're getting there from a technology standpoint where, you can have like an AI kind of front desk kind of person that handles even phone calls for you at this point, or you add the online option for scheduling. These are things where there might be a little bit of upfront cost, but I think they take a lot of hassle away and they bring in a happier patient that, isn't frustrated, comes to you, easy to schedule, comes already more positive, with a positive mindset to you. And then the interactions about all the things that, happen in a veterinary office that are often very challenging, and you have to talk about costs and all those other things. But you start off with a better point where people are not frustrated. They already called 5 practices and got turned down because they couldn't reach anyone or there's no capacity, those kind of things. So I think the takeaway point is that, there's solutions here. The solutions are growing and they're getting cheaper, to avoid the small issues that we ran into. From the rural side, I think, that's a much harder policy situation to address, just like in the human side. Um, you know, Harder to get people to work in rural places. Well, what can we do about those? Travel times are longer. What can we do about those? The caveat of everything we're talking about is obviously that we talked about preventive care. My guess is, and hopefully we can work on this down the line, is specialty care might be a totally different picture. What if you need dental care for your dog? What if cancer care for your dog? And how does that look in terms of wait times, accessibility, and then especially what are the differences between more urban areas where, maybe you have a veterinary, school that has all kinds of clinics and, vet trainees and all that kind of stuff where it's relatively easy to get in, or you live in rural North Dakota or South Dakota or California and struggle those kind of things. So I think there's, lots of opportunities to go and explore this more.
And on the flip side of that, Simon, you just talked how veterinary practice could improve that. What should pet owners keep in mind, and what other expectations should be met when they're seeking preventative care for a new pet?
Yeah, so I think the big takeaways is like generally it's good, but it might not be good in your area, right? So I think planning ahead is really important. I think, especially our scenario was focused on a new dog. Figure out who's gonna be your veterinarian before you get a new dog or do it right when you get it, right? I think, this planning ahead is I think really, really crucial because you have to find someone that works for you, like from an access standpoint, opening hours, driving distance, and all that kind of stuff. But it also, obviously something we didn't focus on is the cost of care may vary significantly across veterinary practices as well. It's changing dramatically all the time, and, you guys talk about this, I'm sure, as well. Private equity coming in, taking over practices, and then the fee schedule changes overnight, so you have to, like, think ahead of these kind of things. I think that's something that, new pet owners or pet owners moving to new areas kinda have to think about because you don't wanna be in a position where I need a veterinarian today, and I haven't even looked at who's close to my house and when they're open and whether they can take anyone and all those kind of things. So, like, planning ahead, I think is crucial in this regard.
That's a really great point. You hopefully wouldn't do that when you're having a new child or moving to a new area. You'd find a primary GP. So that's a great take home.
Yeah, I always tell my friends whenever they get a new pet, I say, get pet insurance and then find a veterinarian. Those are my two like first step things you need to do before anything else.
Yeah, I think the pet insurance is something that we know a little bit about, but there's so much to learn as well. But you guys know this. The cost of veterinary care, just like the cost of medical care, is starting to explode because there's more treatments and more advanced treatments, and we can do so much more for pets than we could just 5 or 10 years ago. But it all comes as a cost, and so you have to like kind of think ahead. What can I afford? What's ethical responsibility do I have to my pet when it gets sick, and how do I manage those kind of things? So like being prepared and kind of thinking ahead in terms of A, having a veterinarian that you can get to, and B, having, the financial protections is really, really crucial.
So, Simon, what are the next research questions that should be explored in this area?
That's a good question. So we alluded to it again a little bit. Specialty care, I think, might be a whole different experience. I've always been lucky, as you know, I'm a professor, and I've basically always been at places that had a veterinary school. So getting in is usually pretty simple. At Wisconsin, where I got my PhD, they have like a cancer hospital and like all the things, dental clinic. So it's pretty easy. But that I think might be different. But again, we don't know enough. I think this is a general call for we know a lot on the veterinary side, like what works and treatments, that kind of stuff. But like the environment of care that we've explored on the human side for I don't know 100 years now, we haven't really pushed on in the veterinary side. Like what does it mean to have access to care? How long does it take? How does it look compared to specialty care or primary care? How does insurance play into this? How to play costs into this? What are the differences in experiences? So I think like there's a general, I think, a lack of research in the general understanding of the veterinary care system. I think that'd be really, really helpful, but specifically focus on access. I think specialty care is really interesting. Rurality is really, really interesting. And obviously we focus on dogs because, personal biases, I guess, play into this, but also dogs are the most common animal that people have. Cats might be an interesting thing, or I know Lisa is worried about horses. So, that might be a totally different story. You might be really challenged even getting into preventive care for a horse. I don't know enough about it, but, that seems like a challenge. Or, there's lots to explore here. I think that's lots of opportunities. I think more people ought to look into it.
Well, personally, I look forward to seeing what you come out with about cats. So if that's on the future horizon as a cat owner myself.
Yeah, it was one of the things I was really curious about, do veterinarians discriminate between dogs and cats in the access? And like, hopefully we can do some work on that in the future.
Well, very cool. Thank you again so much, Simon, for joining us. I always learn something new every time we interview you and every time I read one of your articles. So thank you.
I appreciate it. Thanks for having me.
Thanks, Simon.
For our listeners and viewers, you can read Simon's article on JAVMA. I'm Sarah Wright here at Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex, and don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.